Hello and happy Wednesday. My name is Colleen, and today we are going to be talking about important hard skills for dental hygienists. Okay, so from precise hand scaling techniques to adept use of modern dental software, we're going to be exploring the essential hard skills, or sometimes called technical skills, that dental hygienists need to succeed in today's dental office. So I really love doing streams like these because, these streams and talking about, these topics can really relate to a lot of different people within our audience. So if you are someone who is considering becoming a dental hygienist and you want to know a little bit more about what dental hygienists do, well, we're going to be talking about their top skills and doing an in-depth deep dive into these different skills, why they're important, and how they're used by dental hygienists. If you are a dental hygienist, whether you're new and just starting out, or whether you've been a dental hygienist for some years and you're very experienced, it's always a good idea to get back to basics and make sure that you are staying up to date on the crucial skills that you need to hone throughout your career. And if you are someone who is looking for a dental hygienist role, we're also going to be talking about ways that you can kind of display and describe and exhibit these skills on your resume documents, your application documents, rather, your bio, your resume, cover letter, all of those sorts of things. Okay, so that's what we're going to be getting into today. But before we dive too deeply into that, just want to remind everyone that each week, Princess Dental Staffing is bringing you a new stream covering a new topic regarding your career in the dental industry. So if you don't want to miss out on future streams, be sure to follow our page or subscribe to our channel. If you like the content that we're bringing you, drop us a like. And if you have anything to add to the conversation about the content that we're bringing you, the topic that we're covering, or just about the dental industry as a whole, questions, comments, thoughts, or insights, be part of the conversation and comment below. Okay. Also, just want to take a minute to talk about Princess Dental Staffing. They are a dental job board and they have positions available for dental receptionists, dental assistants, dental hygienists, and dentists, and more, and a lot of different areas. They've got full-time, part-time, temporary, and permanent roles. So if you have some time today, hop on to princessdentalstaffing.com, see what positions they have available in your area. If you're a job seeker, it's super easy to create a profile and get your information in front of hiring managers. If you are a hiring manager, decision maker, you can also hop onto princessdentalstaffing.com and get their contact information, phone number, email address, and they have chat available as well. Also on princessdentalstaffing.com, you can check out their blog, which covers a lot of the same topics that we cover in these live streams. Okay. All right. So let's talk about it. Let's go ahead and dive right into some of these harder technical skills that are crucial for a dental hygienist. First on the list, we have dexterity and fine motor skills, right? So this skill encompasses the ability to manipulate tools accurately and effectively within the confined space of a patient's mouth, right? You've got a small space to work with. You have small tools that you have to use. So dexterity and fine motor skills are really, really indispensable here. So dental hygienists perform delicate procedures that include scaling, root planing, sealant application, and these require a steady hand and fine motor skills. Okay. Additionally, good dexterity helps dental hygienists minimize patient discomfort and increase the effectiveness of treatments as well. This also encompasses things like hand-eye coordination, manual agility, and tactile sensitivity. Okay, because hygienists, like for example, hygienists have to be able to sort of like feel through their instruments, be able to detect, like, for example, calculus deposits or irregularities on the tooth surface that might not be easily visible or, easily or seeable. So this is a really important skill to have and make sure that you continue to hone. Next on the list, we have taking x-rays, right? X-rays are a crucial diagnostic tool. So you have to be able to not only possess the technical ability to operate x-ray machines, but it also, means that you have to have a thorough understanding of certain items such as, for example, radiographic techniques, right? So dental hygienists must be able to, at adept at various radiographic techniques such as bite wing, periapical, and panoramic X-rays, right? Because each type serves a different diagnostic purpose. So proficiency is really required when it comes to choosing and executing the correct technique to ensure that you have the right information in order to perform diagnostics if needed. Okay. Next, patient positioning, right? For taking these x rays, you have to be able to position the patient to ensure that you take radiographs that are clear and that are taking pictures of things that you need them to take pictures of. So you have to know how to adjust both the patient and the equipment to achieve optimized angles for imaging. Okay. And this skill also helps reduce the need for retakes, and that minimizes patient exposure to radiation. Okay. And then radiation safety, right? So, knowledge of radiation safety helps you to safeguard, helps the dental hygienist to safeguard themselves, their patients, and their coworkers. Okay. So, that includes things like wearing the correct protective gear, adhering to safety protocols, and ensuring the radiation exposure is kept to a minimum in accordance with regulatory standards. Alrighty. So next on our list of hard or technical skills is conducting dental assessments. Okay, so dental assessments are listed as the first standard for clinical dental hygiene practice and the standards for clinical dental hygiene practice. So the assessment process includes first of all, taking a health history, right, which gathers demographic and vital signs to understand the patient's overall health. So so this data includes things like I said, demographic information, which is basically like your address, date of birth, contact details. Also vital signs, which include temperature, pulse, respiration, blood pressure, to help identify underlying undiagnosed conditions. Physical characteristics such as weight and height. Social history, understanding the patient's marital status, family, occupation, and cultural practices can impact health outcomes and influence treatment plans. And it also includes, of course, medical and pharmacological history, because records of medication, supplements, known allergies, and adverse reactions, those things, that's really crucial data to have to, make sure to identify the need for further consultation and those sorts of things. Okay. Alrighty. Additionally, this also includes a clinical assessment. Okay. So this involves thorough observation and examination of the head, neck, and oral cavity. So this includes several steps such as oral examination. That includes screenings for oral cancer and those sorts of things. Periodontal assessment, examining gums, noting signs of disease or decay, probing depths, looking for signs of bleeding, attachment loss. And it also includes hard tissue evaluation. So, reviewing the condition of teeth and surrounding bone, charting any decay, demineralization, existing restorations, and occlusion. Okay. Next comes the risk assessment. So, evaluating qualitative and quantitative data from the health history and clinical assessment to identify potential risks to oral and general health. Okay. So, the risk assessment includes examining things such as lifestyle factors. Does the patient use tobacco products? What are their dietary practices? Do they have exposure to fluoride? Systemic health, reviewing conditions that might affect oral health, such as diabetes or cardiovascular issues. Medication and treatments, looking how current medications and supplements could affect dental treatments and oral health. Salivary function, assessing issues like dry mouth that could impact oral health as well. And genetic and family history to help kind of predict whether or not there are going to be future health issues and, try to mitigate those as much as possible if you know about them now. Okay. All right, next on our list of crucial, important hard skills is assisting with dental procedures, right? So, this skill not only involves direct patient care, but also requires proficiency in several supportive tasks and technical competencies. And the components for this include patient preparation and comfort, sterilization and preparation of instruments, assisting during procedures, knowledge of dental materials and techniques, taking and processing dental x rays, which we kind of touched on earlier, post operative care instructions, charting and documentation, and interpersonal skills. Okay, so mastery of this skill really allows the dental hygienist to contribute significantly to the efficiency and success of dental treatments, which, of course, in turn impacts patient outcomes and satisfaction. All right. Next on our list of hard or technical skills is charting. Okay. So don't sleep on charting. This is actually really, really in depth. Dental records are legal documents and therefore must accurately record all aspects of patient care, including data collection, treatment plans, recommendations, referrals, prescriptions, patient comments, treatment outcomes, and patient satisfaction. That's a lot of data that needs to be contained in charts. Okay. So, so dental hygienists who have mastered this skill maintain continuity of care, facilitate communication among healthcare providers, and minimize malpractice risks. So, so what are some of this information like include? Strong documentation can cover all stages, or should, sorry, cover all stages of dental hygiene process of care, assessment, diagnosis, planning, implementation, and evaluation, and record the patient's reason for visiting in their own words. Okay, it should be detailed, thorough, and thorough. Documentation should also be objective and include interactions such as phone calls and emergency visits. Should be legible, okay, concise, accurate, include dates and signatures. Records must be current, properly labeled, and use standardized technology. There is a lot of detail that goes into charting. So it is so important for dental hygienists uh, to hone this skill. Okay. And finally, compliance with HIPAA, the Health Insurance Portability and Accountability Act, is required legally. Okay, so so basically the information has to be safeguarded, and they have to protect. They have to do everything that they can to protect patient sensitive information. Okay. All right, next on our list of technical or hard skills is dental cleaning, right? We're going to get there. We knew we were going to get there, right? So, dental cleaning, also known as prophylaxis, is a fundamental hard skill for dental hygienists. And this all includes, so dental cleanings involve things like removal of plaque and tartar, using specialized tools such as scalers to meticulously remove plaque and tartar, um, tooth polishing as well. So after the removal of the plaque and the tartar, dental hygienists typically polish the teeth, which helps smooth the surfaces of the teeth, remove stains, and minimize future plaque buildup. Okay. Next, fluoride application. So fluoride application is a common step as well. It helps strengthen tooth enamel and fight decay. Okay, and dental hygienists have to know the appropriate fluoride treatment for each patient, which can vary based on the patient's age, risk of decay, and other health factors. Okay. Next, use of ultrasonic instruments. Advanced dental cleaning often involves ultrasonic instruments, which use high frequency vibrations to break down tartar and plaque. Next, assessing oral health. So during the cleaning process, it's really important for hygienists to also assess the overall health of the mouth, looking for signs of potential issues such as cavities, receding gums, oral cancers, and the like. And finally, patient education. So, this is a really essential part of the dental cleaning. It's educating the patients on oral hygiene practices. So, dental hygienists will often instruct patients on the correct brushing and flossing techniques, discuss dietary factors that affect oral health, and recommend products that can aid in maintaining good oral hygiene to make sure that patients stay healthy and well. Okay. So those are our top Hard or technical skills that dental hygienists really should be continuing to strengthen and hone throughout their career. Okay, so let's talk about some of the ways that you can highlight some of these skills and bring attention to some of these skills on your application documents, professional profiles and the like. Okay. So, for example, if you have a profile on Princess Dental Staffing, or maybe you have a professional like social media profile, it's important to kind of highlight these key aspects in like your bio, in your education. So, in your bio, you can talk about, you can just give kind of like general information about yourself and your background. In your education, you can talk about some of the things that you studied. In your experience, you can list the number of years of experience as a dental hygienist, along with like certifications, relevant certifications. Software as well, you definitely want to list dental related software. Specialties, if you have a specialty as a dental hygienist, you definitely want to list that. And some languages. So if you're fluent in another language, you can also highlight that as well. It helps you to communicate with a wider audience of patients. Okay. On your resume, you want to include industry specific keywords that relate to essential hard skills. Things such as dental cleaning, x ray proficiency, periodontal charting, dental software, oral assessments. So, these things are really important to include. They are industry terms and they tend to be keywords and phrases. Okay. And that will help you perform better throughout the applicant tracking system. Okay, which some offices do use in order to screen applicants. Okay. In the experience section, you definitely want to focus on the hard skills and you want to demonstrate those as well. And the way that you kind of do that is you tie your actions to direct results. So, for example, you could say something like conducted comprehensive dental assessments, identifying early signs of periodontal disease, which improved patient outcomes through early intervention, right? The action of this job seeker is clear. They conducted and identified, and the result is that it improved patient outcomes through early intervention. Okay, so you want to make sure that you're demonstrating your knowledge and your ability to perform these skills and tasks and why they're important. And we do that by talking about your actions and tying them to direct results and outcomes. Okay, you also want to list your certifications and licenses in areas like dental radiography and other specialized procedures. Uh, Technical proficiency section as well. So you might want to consider adding a section on your resume specifically for technical proficiencies. It makes it easier to tailor your resume for ATSs to have like a skills section. So you may include skills such as digital operating like digital radiography equipment or specific dental hygiene software, things of this nature. Okay. Education and training, you want to highlight any coursework or workshops that are directly relevant to the hard skills required for dental hygiene. And results and achievements. Again, you definitely want to talk about your tasks and responsibilities and your actions, and you want to tie them to direct outcomes. For example, reduce patient recall rates by 15% through effective dental assessments and individualized oral hygiene education programs. Okay. All right. And then in your professional summary or objective, which is usually like the first part of your resume, you want to start with a strong summary or objective that encapsulates your key skills and experiences. For example, you could start off by saying dedicated dental hygienist with 5 years of experience in fast paced dental clinics, skilled in x ray imaging, patient education, and performing comprehensive dental cleanings with a focus on preventative care. Okay, lots of great keywords in there. On your cover letter, you definitely want to talk about your hard skills by weaving them into narratives and anecdotal, sort of evidence experience. Okay. And I have some examples for you, which, after this video posts, I will go ahead and copy and paste the link to today's blog post in the comments below so you can kind of see some of these examples. But you definitely want to tailor your skills to the job description throughout your resume and the cover letter. Okay. So make sure that you're reading these job descriptions, that you're pulling out the key tasks, responsibilities, keywords, and phrases, and integrating those and weaving those throughout your application documents. You also want to demonstrate these things using specific examples if you can, pulled from your experience. Um, Again, you want to highlight relevant certifications and trainings to demonstrate that not only do you have this knowledge, but that you are someone who likes to continue to hone that knowledge. Okay, throughout your career. Okay. Connecting your skills to patient care and clinical goals. Again, talk about your actions and and tie them to direct results and outcomes that are related to results and outcomes that are related to what is beneficial for the practice, but also what is beneficial for your team and your patients as well. Okay, and make sure that you include a strong closing in your cover letter. um, you know, you could say something, you could like reiterate your enthusiasm for the role. You could talk a little bit more about the value you bring in, mention your eagerness to bring your hard skills to the new team and contribute to the clinic's success, those sorts of examples. Okay. In your job interview, you want to make sure that you highlight your hard skills by preparing to discuss specific examples and demonstrate their technical expertise and how those skills have positively impacted the work that you've done. So again, prepare concrete examples. Something that may help you is the STAR method. So STAR is an acronym. It basically stands for situation, task, action, and result. Okay. So when you are giving these concrete examples, make sure you describe the situation, the tasks, and the tasks that needed to be done, the actions that you took, and the overall results. So it's a great way to kind of memorize or remember, how to present these concrete examples in your interview, the STAR method. Okay. You also want to do things like discussing your problem solving skills, linking your skills to patient outcomes, bringing up continuous learning, using relevant terminology that is industry related, asking technical questions, and tailoring your skills to the clinic's needs. Okay, so those are all things that you kind of want to talk about in the interview process. And if applicable, you can also provide artifacts. So, if appropriate and available, consider bringing along visual aids or reports that showcase your skills and achievements, such as before and after photos of dental treatments, while ensuring that they are HIPAA compliant. Patient confidentiality is always top priority. Or, feedback ratings from, previous employment, like letters of recommendation and those sorts of things. Okay. All right. So, just to kind of wrap up, we talked about a lot of different great things today. We talked about, all of the different hard technical skills, the top ones that dental hygienists need to make sure that they have and continue to strengthen throughout their careers. We took a deep dive into each. And then we talked about how you can kind of demonstrate those skills on your cover letter, on your professional profile, on your resume, and in your interview if you are looking for a dental hygienist role. Okay. So that will do it today. That will do it for me today, everyone. Like I said, after this video post, I'll go ahead and include the link to today's blog post below so you can see some of the examples of the things and techniques that I was describing. We will be back next week with a new topic covering a new topic regarding your career in the dental industry. But until then, hope you have a great week. Hope you have a great weekend. Continue to stay safe out there. I'll see you soon. Bye, everyone.